Dude. All right, so here we are on another episode of Innovators of Health with our guest today, Dr. Kevin Logan from the Logan Institute, and my co-host, Dr. Rahul Desai. So, Dr. Logan, thank you so much for being here with us.
Yeah, happy to join you guys. Thank you for having me.
So, just a quick, how did you and Rahul meet?
We met through Rejuve Med, and Dr. Desai gave a lecture on red light therapy, and then we just connected because of my past interest and application of a variety of photobiomodulation in my clinic, and then we just hit it off and have been in conversation ever since.
Awesome. Well, from what I know of you, you've had a pretty unique journey, and you've had the Peace Corps, and you worked, internal medicine, and now you have your own integrated clinic. So I'm just curious, what are some pivotal moments that led you down this path of functional medicine and regenerative medicine?
Well, I've always been interested in trying to really identify the root cause of illness and have spent a great deal of time trying to understand what the etiology is behind every condition that a patient presents to me with. And that requires in-depth diagnostics. And that's why I chose internal medicine. But that's only the beginning. So we got to make the diagnosis and really understand what's causing the disease within a patient. But then we have to find new ways to really apply therapeutics in an effective way to help the patients get the solution that they're seeking, whether it's functional medicine using nutritional IVs, photobiomodulation, doing regenerative therapies, a whole host of things. And that's the beauty of what we do, is we're always looking for what's the cutting edge solution, what is the newest discovery from a scientific standpoint that's going to give the patient the most benefit and get them well and on their journey of health.
It's cutting edge in photobiomodulation. I mean, you're definitely an innovator there. And so let's talk about red light. What first caught your attention about it, and especially in the context of playing a meaningful role with healing your patients? Because I know you're really big on that.
Sure. So I first was introduced to photobiomodulation about 25 years ago, and I'll tell you a little personal story of how this came to be. So I was at a meeting, and there were some vendors in the vendor area that were demonstrating a device called the light beam generator, and I was curious, a little skeptical, to be honest with you, and was talking to them, and then we took a break for lunch, and I went outside. We were down in Florida, so I decided to eat lunch outside. And I got stung by a bee on my right hand. And I'm very sensitive to bee stings, not in an anaphylactic sort of way, but I swell immediately. And my hand swelled up within 30 minutes. So I went into the vendor area where they were demonstrating this light beam generator. And I said, "Hey, I just got stung by this bee. Is there any chance that this device might be able to help me with the swelling in the tissue?" And they said, "Absolutely." So they put the device on me. And literally within 30 minutes, the swelling had reduced by about 75%. And normally, after a bee sting, I would be swollen for days. And I said at that moment, I said, "I'm not sure how this is working, but can I buy that device?" And literally, because I experienced it with my own body, and knowing how sensitive I am to bee stings, I was like, this thing is incredible. So that was the beginning of my journey, and that was, I think, in 2000 when I was first introduced to photobiomodulation.
That's an awesome story. It really brings to light something that we've seen with photobiomodulation, but also the kind of the company with Redvive. It's we got to get these medical devices in the hands of the clinicians and their staff. Once they experience it on themselves, it's the race is on. Like they feel it, they experience it. We're all dealing with some sort of issue, but what a cool story where you had that kind of acute uh, flare, that immune response, right? And you're like tempering that and modulating that. Um, we looking, speed, knowing you, working with you, understanding like the complexities of the cases that you're dealing with. because you're such a holistic practitioner and dealing with pretty complex cases, from orthopedics to, immune conditions and things. How have you incorporated uh, red light therapy into such a diverse practice? And have you built, because I know you're using it all the time, both in clinic and with Red Vibe at home. How have you integrated that, or how have you leveraged this technology into different protocols?
Well, the interesting thing is when I was first introduced to the light beam generator as my first device that was delivering photobiomodulation, one of the conditions that we see in medicine that is really poorly treated is lymphedema, whatever the cause may be of the swelling of the tissue. And we don't really have tools. There's not a specialty within medicine that deals with lymphatics. We just think, they're these collecting ducts, and they just bring the fluid back to the heart. And if they're not disrupted from trauma or surgery or anything like that, then everything should be good. But we find people that end up with these chronic, lymphedema, and that was actually the first application that I used the photobiomodulation was really for lymphatic therapy. So we used it for chronic sinusitis when people have, if they have chronic recurrent strep throat, they get a lot of swelling of the lymph nodes of the neck, and then things back up into the sinuses. Doing that lymphatic therapy with a light therapy was so powerful because we could also penetrate deep into the thoracic cavity where the thoracic ducts, where the lymphatic ducts empty into the venous system. And so that application was really powerful, and I helped a lot of people along the way. And so we used it for acute and chronic inflammation from infection and a variety of things. And then as the science continued to advance and the technology continued to advance, we began to see all these other applications. And as I was preparing for the podcast, I was just reviewing some of the clinical studies because there's been so many studies done, and it's incredible the science that's out there. And this is just so underutilized in medicine, and yet it's such a powerful tool. And when in the example of lymphatics, I mean, we might send somebody to a physical therapist that does manual lymphatic therapy, but the light therapy actually is so much more effective and so much faster, and it can penetrate deeper than a manual therapist could ever do. So I think that's just one aspect of the application of photobiomodulation that I've used over many years. And then, of course, we have other conditions, wound healing. We do see some non-healing wounds. And of course, we incorporate a lot of other applications of ozone therapy and other things that we use together. So we get this synergistic effect of using either PRP, PRF, ozone, and then the light therapy in combination to really see advancements in the patient's condition in so many different ways.
Are there any cases that you've been, leveraging the Red Vibe device that have really stood out to you or moved you, or have you seen, especially with the ability to take it home, anything that's surprised you or uh, changed the way that you've approached things?
That's a good question. And I do have one case. It's a young woman. She's been struggling with endometriosis, very severe endometriosis, and pelvic and abdominal pain. And she was getting no relief. She was, on maximal hormone therapy, hormone blocking therapy to try to slow down the progression of the endometriosis, but she struggled with pain, daily. And then obviously at times even worse, depending on where she was in her cycle. And the application of the Red Vibe and the red light in her case was life changing. And she basically came to me in tears after she had purchased the device, started using it, and said, "I don't have any pain," and that was just a gift.
Beautiful. Was she using it pretty much on a daily basis, or how did you protocolize that?
Yep, she was using it every day for about 20 minutes a day, and she had a pretty quick response. I mean, I'd say within probably 2 weeks, she was starting to see reduction in her pain, and then she continues to use it. She's using it in other ways, as we learn more about some of the modulation of the circadian rhythm, which, thanks to you, Dr. Desai, that was not the indirect application of the red light and circadian rhythm has been also another big way that I'm applying the technology, because I tell patients you can do this direct therapy and then you have indirect therapy. So you see all these other benefits. And when they're using it regularly, they're getting amazing results and just continue to use it because they feel the difference.
So cool.
While we're on this, while you're sharing some more of these stories, can you share a couple of more that really surprised you? Maybe going into it, you had a different feeling about it, but then a case that really just shocked you that, with using with Red Vive?
So I actually had a case in yesterday, as a matter of fact. He's a physical therapist. We work very closely together. He employs a lot of different modalities, manual therapy, a lot of osteopathic treatments and things. And he's an avid hockey player, and he also water skis in the summer. And he texted me yesterday, and he said, "Hey, I think I tore my lateral quad." And he's obviously a PT, so he knows the signs and symptoms. And I said, "Get over here. I put the ultrasound on to check, first to assess whether, there was a complete tear. And then we put the red light on him for 20 minutes. And he actually texted me last night and said, I can't believe how much less pain I'm in today, at the end of the day after just doing that for 20 minutes. So that was pretty incredible. And that's just, when you see those acute injuries and you have the ability to actually help people get out of pain, and not just out of pain, but it's really helping their body to heal, because he's got a long recovery ahead of him. But that was a pretty incredible story.
I have an anecdotal case, Kevin. I think I talked to you about it though. Just I was like working out and tweaked a nerve in my pinky, and it was like 9 out of 10 pain, very neuropathic, electric shock like. And I put it in front of it was that same day. I got home and I was like, I couldn't hold anything, and I put it in front of the Red Vibe device, and within 2 or 3 minutes, all the pain went away. It was incredible, that neuropath, like that stinging, burnt, like electric sensation. And 6 or 8 hours later, it was back, like fully back. And did it again, 2 3 minutes, completely gone. It was really kind of triggered that, what it's doing with capsaicin receptors and the anti-inflammatory effect, but almost like how we can use it as an acute rescue medicine without having to take an oral Advil or something like that. And the effect is so quick. It's just another use case that I hadn't really thought about, and then used it. And I did that. I had to repeat that dosing cycle for several days to keep the pain away. And then over time, I was able to spread it out, and then it went away. It was really interesting, as you brought that up. When somebody comes in with an acute issue, or if they have that at home, it's something that it didn't come to mind that I should use that right away. So it was interesting.
I was going to ask you we're talking about the body's ability to heal here, because it just being such an intelligent system. What do you believe it is about red light that's allowing our body to heal,
Well, I think one of the greatest effects is really that increased energy production. So the stimulation of the mitochondria, and the chromophores that exist within the mitochondria to increase energy production. Because I would say that many people out there are really suffering with energy deficits, and mitochondrial dysfunction is a chronic problem. And I would say that's really at the root of a lot of the patients that I see, with whether, they may complain of chronic fatigue syndrome, and that's sort of the ultimate, sort of deficit of mitochondrial function and energy production. But there's also just sort of this, I don't have as much energy as I used to have, or, it's sometimes it's more subtle, or they're not able to heal as quickly. And the effects of the red light and near infrared on on those chromophores, those receptors within the mitochondria, and the effects that it has on stimulation of ATP production is incredible. So it's not only anti-aging and energy producing, but it's actually it's giving the body another way to facilitate faster healing. And, I liked, what Raul said, I think at our last meeting, was that red light and photobiomodulation is medicine. And I think that's a really good way to state it, because it's truly medicine. I mean, in a way that um, taking an Advil, or, taking a supplement, or, vitamin C or whatever it may be that we're going to employ, to affect some physiologic change, but it's utilizing the body's own healing response. And that's the cool thing, because we're actually just using what we already have and enhancing that. And so I'd say for me, that's a big factor, because if we can restore energy, and you name, let's talk about, any viral illness. I mean, viral illness, environmental toxins, what do? They really target the mitochondria. The mitochondria are very sensitive to all kinds of insults. And so we lose number of mitochondria, and we lose function of mitochondria. And if we can restore that, that's going to help that patient help their body get restored back to its original state of homeostasis or balance and health. And I just think it's a great tool for people to have.
Thank you for that. You've had a background in both traditional and also holistic, meaning Chinese medicine, correct?
Yes.
So, how do you think Red Vibe bridges the gap between modern and ancient healing wisdom? There's always this Western medicine and Eastern medicine sort of people, question those two sides, but this is something that seems like it's bridging the gap. What do you think about that?
Well, I think that's a very interesting question, Jay, because the Chinese talk about energy, and qi is, just what they consider to be an ethereal form of energy. Well, we're energy bodies, right? Our cells are they're energized, and they carry a charge, and that's how how the cells communicate, how tissues and organs communicate. So it's really, the Chinese understood, energy medicine, but also how to impact that in a way that, I mean, ancient traditions, I would say Ayurvedic, principles kind of fall into line with a lot of those types of applications as well. But I'd say that we have a better understanding of the science, and we know how things are working, maybe in a different way that the Chinese basically learned through observation, which is a valid scientific method. But they had, think about it, millions and billions of observations over, eons of time with patients. And when you hear the language in Chinese medicine, you can actually translate whatever those words are into scientific principles today. And they knew the neuroanatomy of the spinal cord, and all the nerves, exiting the spinal cord, and what organs they innervated, because there are very specific acupuncture points on the back of the spine, and they correlate perfectly with all the neuroanatomy that we understand today. They never dissected a human being. They just knew that this point affected the liver, this point affected the heart. And that's pretty neat. And I think, they didn't really they didn't have they didn't have access to red light and all these things, but they had access to a lot of other things that I think are worth, visiting and incorporating into the practice of medicine.
Yeah, you've spent your career helping patients, develop a unique approach to their own health. What would you say to the docs that are out there? I mean, you've been experiencing red vibe and red light therapy in general. Those that are hesitant or kind of on the fence as looking at this as potentially, alternative or not validated and not within the kind of the standard, you know, uh, big pharma or device industry. Would you have any advice for people that are just getting introduced to this sort of medicine?
Yeah, I mean, I think, we're always looking for science and evidence-based, medicine when we approach a patient, to make sure that we're employing good science and whatever therapeutics we're going to try to, positively affect change in a patient. And I would say, I've been using different types of photobiomodulation devices for 25 years with pretty incredible successes and really no side effects. I mean, honestly, there's very little downside. And with medications and surgery and all the other options that are out there, there are always potential side effects, and that's a big problem for many people today, is they're experiencing side effects. And with photobiomodulation and red light therapy, unless you overdo, or if you're applying it too close or for too long, yes, you could potentially experience some side effects like fatigue and other symptoms. But in general, if it's used correctly, there's really very few side effects. And I can't say that about most things that are used in medicine today, because why do we always have to give informed consent before we prescribe anything? It's because there's inherent risk. And I would say the minimal, there's such great benefit with such minimal side effects potential. It's a win-win for the practitioner and for the patient, because you don't have to worry about it. I mean, I always am concerned about anything that I do, to the patient or give to the patient. I'm always thinking, okay, I've got to look at this person and what are the potential side effects, because we have to always consider that whenever we prescribe whatever it is that we're prescribing or whatever procedure we're actually going to employ. And I would say with light therapy and photobiomodulation and the science that backs it up, there's so many benefits. And it's, like I said, it's underutilized. I mean, some of the research on osteoblast activity, increased bone healing. I mean, after a fracture, why not? I mean, if we can accelerate bone healing and see that a patient could potentially get out of a cast 2 weeks earlier or whatever it is, I just think it's just another tool that we can utilize to really enhance, that and accelerate that healing effect. So I'd say for any hesitant docs, I mean, the science is there. There's no doubt. I mean, there's volumes of science behind it. I mean, and we just have to decide how we're going to apply that in whatever specialty of medicine that we're practicing.
That was a great answer. If you had a magic wand and you could, wave it, and one or two things that you could have practitioners and patients understand about photobiomodulation and red vive therapy, what would that be? What comes to mind?
I would say, kind of back to, enhancing the innate healing response, is number one. So, so if we can help people to, recover faster and help them feel better, I mean, at the end of the day, that's what it's all about, right? We're trying to make patients feel better. We want to reverse disease processes when possible, but then, we also want them to be, feeling better after whatever therapy that we're employing. And I would say with photobiomodulation and red light, they're going to feel those effects, and they're going to see those effects, fairly immediately. And not just pain, because pain is a big driver of why patients, go to see physicians. Somebody once said, the reason patients come to the doctor, it's two things: pain or pus, so they either have pain or they have an infection. And red light and photobiomodulation actually can do both of those, because we didn't even talk about wound healing, but enhanced wound healing. Think about MRSA, some of the bacterial, the antibiotic resistant bacteria. I mean, these things are powerful tools, and I use photobiomodulation in combination with other things like ozone therapy and things like that, which are, pretty much, I say 99.9% effective at, killing bacteria. So when we use these together, I think the patients are going to, experience those effects, and it's just a long-term solution that I think is very safe for most everybody.
Very cool.
I'm sorry. I got a little distracted with the magic wand, because I guess if I had a magic wand, I'd say I think everybody should have one in their home. It should be in their medicine cabinet, right?
Yeah. I mean, that's part of our mission statements and, our values. It's we see not only, like you said, there's a time when a patient comes to see a physician, they're in need of something. They're in pain, they have an injury, they have an infection, there's something that's a trial or tribulation that they're dealing with, and we're able to help them. And then we can get them this sort of device, especially that goes home with them, that's really changing the trajectory, because it's one of the few things that should never go into the closet, right? It's something that's going to be utilized, and that's why I love it. It's changing the trajectory of their health. They're implementing it now, but now they're going to be able to use it forever, and for different reasons. Right? And so, or even different family members. Like, you were speaking of bone healing. My wife, actually, she's avid hiker, and fell on a hike backcountry camping, dislocated her elbow, broke her radial head, fractured her fibula, and thank goodness, did not require surgical intervention. There was a little question, and she was, getting photobiomodulation from day one or day two by the time she got back from from hiking that did get her out of there. And then she's had an amazing course, both pain wise, dramatically reducing the pain and functionality, but then now healing. We went back and everything looks fantastic and healing at an accelerated rate. So we don't have to do anything, just watch and, continue physical therapy. So that was able to, and obviously that wasn't the intent of the device when we got it, but it was really nice to have in the home. So just another application.
Well, that reminds me, Raul. So I had one patient actually come in yesterday, and she's got a non-union fracture of her left radial head, and saw the surgeon, and he was really reluctant to operate, and she has underlying rheumatoid arthritis, and she's got a lot of risk factors. And actually, after she fractured her radial head, there was no break in the skin at all. She developed MRSA of the bursa, believe it or not. And she got a bursitis that was actually a MRSA infection. And so she came to me because she was interested in regenerative therapies to try to help with the non-union fracture. And the first thing I prescribed to her was the Redvive. I told her, I said, I'm gonna put you on some supplements, vitamin K2 and some other bone building supplements, so we can get this, healed. I also recommended pulsed electromagnetic field therapy to try to help with bone healing. But I said, you can go home with a red light today and start applying this. And she did not want to have surgery because she actually had a knee replacement that required, that got infected and required 3 additional surgeries. And so she's very reluctant to have any more surgery. And I don't blame her for that. And I said, this is, and I sent her home with the information. So hopefully she follows up, but she's wanting to avoid surgery. So I'll have to give you guys an update when I come back on the podcast and let you know how she's doing.
Absolutely.
Absolutely. This has been sitting here listening to you. It's just, there's a sense of gratitude, because of this medicine and what it's doing for people. Um, are there any questions that we have not asked you yet that you were prepared to answer coming into this podcast?
No, I mean, I think it's, getting the message out there to more physicians and to patients, I think is really the key. And I appreciate you guys doing this because, the more that people become educated, the more they're going to realize, hey, I can take my health into my own hands, and I can, acquire tools that are going to help me. And that's what we do. And that's what I do every day is I'm like, I'm not going to follow you home and, tell you what to eat, what not to eat, but I'll give you advice, but you got to do it at the end of the day, And so the more we empower people and the more tools that we can give them to help themselves, I'm trying to work myself out of a job. Honestly, I have more patients than I can handle. And so I want people to be empowered. And this is just another tool that will help them.
Well, thank you, Dr. Logan, for being on the show. I mean, we are grateful, and we'll definitely have you on again, because we're looking just eagerly awaiting just more of these stories that you shared with us today. So thank you for that.
Okay.
Thanks, Kevin.
Thanks. All right. Appreciate it.